Good. So this is going to help, especially if you were typing for a while, or if you have a desk job, your wrists are constantly going to be up like this when you're typing. So then that is going to help you relax that muscle. It's going to help. Now that that's stretched, it's going to help kind of guide the muscles back to where they're supposed to be. It's going to help with the pain, decrease that inflammation.
Hey guys, welcome back to another video here at Oak Brook Medical Group. In today's video, we're going to go ahead and talk about wrist pain. So a lot of our patients that come in, they actually have seated desk drops, so they're constantly in this position, putting a lot of strain onto their wrists, their fingers, their forearms. Or if our patients come in and they're pretty athletic and they're constantly, moving barbells, dumbbells with their wrists or their forearms, that could cause pain as well too. Some of the pain that our patients describe is achiness within the wrist, maybe sometimes it's throbbing even into the fingers, tight forearms, weak grip strength, which is going to go along with having those tight forearms, and then numbness and tingling. Sometimes they could have it maybe from the elbow down to the wrist. That could be a wrist problem, but that's most likely going to be coming from the neck, which is also something else that we can check out for you when you are here. The types of treatments that we do have in order to help our patients are just some simple adjustments, getting motion back into those wrists, a lot of stretching that we'll show you within the videos, range of motion exercises, but then also strengthening exercises so we can strengthen the forearms to help take away that pain within the wrist. And then massage therapy and scraping, which we'll also show you some videos of that.
Hey guys, welcome back. I'm here with Katie, and we're going to show you something that we do with patients that come in with wrist pain, especially if it's an acute injury. We're going to use kinesio tape. This is going to help give you more range of motion. It's going to help decrease the inflammation. And here we go. All right, so we're going to start with the extensor side. So what I'm going to have her do, I'm going to have her flex the wrist a little bit there. So it's going to stretch the extensor side. So we're going to go ahead and put the kinesio tape right on top here. We're going to anchor it. We're going to pull the tape. Make sure we pull this here. So we're going to have it just a little stretch. Go all the way there. Now this is going to help kind of bring the skin up. It's going to decrease the inflammation if they have that acute injury there. And then after we do that, we're going to anchor the tape right on top of the wrist, right here. Good. Then I'm going to have you flip your hand up this way. Good, keep that hand stretched there. Come on this way. And this way. Good, so this is going to help, especially if you were typing for a while, or if you have a desk job, your wrists are constantly going to be up like this when you're typing. So then that is going to help you relax that muscle. It's going to help you decrease that inflammation that you have there. All right, guys, so now that we're done with this, we're going to go ahead and do the flexor side. So that will be more of like you're grabbing the mouse, or like you're doing a lot of stuff at the gym and then something happens. This is usually the muscle that gets hurt. So I'm going to go ahead and take this now. So for this one, yep, perfect. I'm going to be right there. So now doing this is going to stretch that. Similar as the other side. You can grab the tape there. Give that a little bit of a stretch. Good. Now that that's stretched, it's going to help kind of guide the muscles back to where they're supposed to be. It's going to help with the pain, decrease that inflammation, and this would also help if you have carpal tunnel syndrome. This would also help with that as well, especially now that everybody uses their phone, their computer. So we're going to go ahead and do that. So now every time she goes down, she's going to feel the tape stretch a little bit. And it's not gonna make her go all the way down where she feels the pain. It's gonna help her protect that. And that's what we do.
All right guys, within this video, we're gonna go ahead and show you more of a strengthening exercise that we have our patients do to help with the flexors and the extenders. So what our patients do, you grab any type of weighted ball or weighted object. The first one we're gonna do is working those flexors. So you let the wrist fall as far as you can, holding on to the object. You're gonna go ahead, bring your hand and wrist up to your forearm, focus on activating the flexors, hold for a few seconds, and then go ahead and come all the way back down. You really want that stretch and then that activation. Now the other way is you're gonna have your wrist, basically same thing, come up towards your forearm, but this time your hand is going to be down facing the ground. Same thing, let the wrist fall all the way down, and then you're gonna go ahead and bring it up, activating the extenders. Same thing, go ahead back down. That full stretch, full activation. Our patients do this 3 sets of 10, basically whatever you want them to do, but this is gonna help strengthen those forearms to help decrease any type of wrist pain that you haven't experienced. All right guys, so in this video, we're gonna go ahead and talk about some stretches and some exercises that we have our patients do that do have wrist pain. The first stretch is super simple, super easy. You can do this throughout the day if you'd like. You're gonna do 2 different movements. So the first one is flexion. So you're taking one hand, the other hand pressing it against your palm and just bringing your fingers up as high as you can without pain or discomfort, but you should feel a good deep stretch. Under here, we're gonna work on those flexors. The next movement is the opposite direction. Same thing, drive that wrist, those fingers down towards the ground as far as you can without pain or discomfort, but far enough so you do feel that stretch along your extenders. Just go back and forth however many times you would like. Hold it for however many times you would like. This is gonna help decrease pain, but then bring back some motion into the wrists. The first exercise we're gonna do, this is more of a range of motion exercise. So this will increase range of motion and then increase your grip strength. So what you're gonna do, we're gonna have the patients take the bands, arms are about shoulder width apart. You're gonna go ahead and bring your wrist down towards the ground, almost as if you were able to supinate your hand. So you're gonna go down, hold for 2, and then come back up. The next one we're gonna do is pronation. So you're gonna bring your wrists together almost as if you could, without the band, bring the wrist down towards the ground. Pronation. We're working the same muscles that we were talking about within the stretching video. This is gonna help, like I said, increase the range of motion and then increase that grip strength as well.